One of the biggest questions we face as surgeons is, do I have enough fat to really give you a nice result? And the principle here is trying to take one fat cell, move it to the backside, and get that fat to grow, and put in as many of these fat cells as we can, and I'm usually getting about a 60 to 70% of that particular fat to live. Now, how much fat am I going to have? Well, that's the big question. Some people come in very, very skinny, and I know I'm not going to have enough fat, limiting me to implants. Some people are going to have a tremendous amount of fat, knowing that, okay, great, I got plenty of fat. But what about those that are in the middle? Here's what I do. I send you to, not boot camp, but really booty camp. What does that mean? This means that you get to eat whatever you want. It's the best prescription you're ever going to get in your life, and I'm going to give you that prescription because I'm going to want you to gain 10 to 15 pounds to really make a difference. Now, you can gain this weight really in a matter of weeks. It's very, very easy. We'll teach you how to do it when you come into the office. I lived it myself. I gained the weight myself, and it was a lot of fun. The bottom line is that in those patients that are in between, I'm going to have you gain weight. If you don't gain enough weight, then I'd have to turn to implants for the augmentation. And oftentimes I'll combine implants with fat. But I got to tell you, 95% of my patients, I'm able to get them to gain the weight, and I'm mainly doing fat grafting. The whole purpose of fat grafting is to use your own body tissue and to try to avoid the complications that you'll see with implants. Whenever you put implants in the body, you face a lifetime risk of implants hardening, implants moving, developing fluid around the implants. So if I can get rid of that complication or that factor by using your own body fat, I'm going to try that every single time. But one of the things I want you to remember is that if I select the patient right, you don't have enough fat, implants can be done safely. But it takes a certain particular patient and anatomy for me to give you a good result with that. Bottom line is, we're going to go for fat, we're going for broke. Fat is the new liquid gold. This is revolutionizing plastic surgery. Not only can I augment the buttock, I can augment breast, I can augment deltoids in men, pectoral muscles in men, I can augment calves, I rejuvenate face with fat. Fat really is revolutionizing plastic surgery.